this is Yolanda Carter, and I'm going to share with you information on cardiac murmurs and how the murmur can be used as a marker for a diagnosis of aortic valve stenosis. The information that I will share with you is based upon findings of a patient I took care of in clinic. So the teaching method that I will use today in this video is in the format of a SOAP note. So let's go. So let's start out with cardiac murmurs. So cardiac murmurs are pathological sounds usually produced in an affected heart. The main mechanism of the heart murmurs is the turbulent flow of the blood, which is caused by the obstacles in the blood flow. There are two types of murmurs. A murmur can happen in the endocardiac system, which arises inside of the heart, and those occur more frequently. And then the other is extracardiac, and those murmurs arise outside the heart. Systolic murmurs, which will focus on, occur with the S1 during the short pause of the heart. They are synchronized with both the heartbeat and the carotid pulse. Often in healthcare, especially as nurses and physicians, I'm sure hear it too, when during their assessment, a patient will say, "I have a heart murmur." So what that means is that there has been a narrowing in the aortic valve, which lets blood pass from your heart to your aorta. When this occurrence happens, the murmur can be heard using a stethoscope. Systolic murmurs occur with the S1. During the short pause of the heart, the murmurs are synchronized with the heartbeat and the carotid pulse. A systolic heart murmur is an irregular whoosh or whoosh, swoosh when your heart muscle contracts. Sometimes this sound occurs for no known reason and causes no problems. Other times, though, heart murmurs point to other heart conditions. In the patient we will discuss, the systolic murmur was a finding that led to the patient's diagnosis. Murmurs heard when listening to a patient's heart via stethoscope can signal heart disease. I've listed several. The first one is aortic stenosis. That's swoosh, swoosh sound that we hear through the stethoscope. Other conditions could be mitral regurgitation, aortic regurgitation, mitral stenosis, or patent ductus arteriosus. All of those are important. So now that I've shared some brief information about murmurs and the importance of murmurs, and especially the systolic murmur, I'm going to share with you information about my patient who I saw in clinic and how his systolic murmur led to his diagnosis. So this patient showed up and I assessed him, and his chief complaint is, "I have shortness of breath, chest pain, fatigue, and a feeling of faint with any activity." Now that I've shared with you information about systolic murmurs and how important they are when you hear them concerning diagnosis, I'm going to share information with you about a patient that I saw, and I used that information to help me tentatively diagnose his case. My patient is a 72-year-old retired accountant but active Hispanic male who visited the clinic complaining of chest pain and shortness of breath when engaging in a physical activity, fatigue during times of decreased activity, and feeling faint and dizzy when he gets out of bed too fast. He states that the symptoms started 3 days ago and they get worse with any physical activities. The example the patient gave is, I used to walk to the store a few blocks away, but now I can't finish a half a block before the symptoms begin. And most importantly, I haven't been able to work my farm. Patient states he was diagnosed with hypertension 3 years ago, and he has taken Norvasc to maintain the condition, and states, I have never had similar symptoms before. He says that when he experiences the symptoms, he is forced to stop what he is doing and to rest, after which the symptoms disappear. The diagnosis for this patient is aortic valve stenosis. The indications for this is the patient's symptoms. He had a systolic heart murmur. He had chest pain with activity. He was feeling faint and dizzy with activity. He experienced shortness of breath with activity. This is important because the aortic stenosis is a heart valve disease that occurs when valves between the lower left heart chamber and the body's main artery, which is the aorta, is narrowed and doesn't fully open. This reduces or blocks the blood flow from the heart to the aorta and the rest of the body. Here we can see the aortic valve itself, and then we can also see where the aortic valve normally opens completely to allow blood flow to flow from the left ventricle to the aorta. When closed, though, the aortic valve closes tightly to keep the blood away, allowing backflow for leakage. A normal valve is greater than 2 centimeters. But look close. You can see what it looks like as in stenosis. There's opening and there's a closed one. Now let's study the etiology of aortic stenosis, which is commonly caused by calcium buildup on the aortic valve over time. If you remember the slide before, at the bottom you showed how it was opening, but you saw the calcification there. That's what happens. These calcium deposits that often come with age, and they make the valve tissue stiff, narrow, and unyielding. It generally occurs in patients with underlying heart defects or conditions such as hypertension, which our patient has. Aortic stenosis, which is called AVS, it's really a heart condition that occurs when the aortic valve narrows. Again, the valves are then unable to open fully, hence reducing or blocking blood flow from the heart, and that blood takes care of the whole body. When the heart has to work harder to pump blood to the body, patients can experience the symptoms that this patient is experiencing. Chest pain, abnormal heart sounds, the murmurs, feeling dizzy and faint with activity, shortness of breath, and fatigue, even when they are at rest. Aortic stenosis is the second most common valvular lesion in the United States. It is present in about 5% of the population at the age of 65, with increasing prevalence with advancing age. A hallmark sign of aortic stenosis is what we've been studying, a systolic murmur. The murmur occurs when the heart muscles contract. Systolic murmurs, just for reference, are graded by intensity, loudness, and it can be from 1 to 6. With this patient, the loudness was about a 3. The prevalence of a systolic murmur in females is 31%, while males are not far behind with a 23.9%. The most important part of the plan for this patient is throughput. This patient has aortic stenosis, and it must be addressed immediately. The patient also has signs and symptoms which concern him because it hinders his livelihood, his ADLs, socializing with his family. But at this time, no further testing is required to confirm the diagnosis in the clinic. However, the patient will be referred to a cardiologist and a thoracic surgeon. The patient will be asked to continue with his medications that he has, and the patient will get the opportunity to have an answer question session, so that we know and he knows that he understands what is going on and what is necessary for his continuity of care. Education is imperative for this patient. The patient will be instructed to eat and maintain a healthy diet. The patient will be instructed to regulate his physical activities. The patient will be asked to manage his stress. The patient should be advised and will be advised to abstain from farming work, his leisure activities, other than light ones, until advised by the cardiologist. The patient, most importantly, will be asked to return to the clinic if symptoms persist or if he cannot secure an appointment with the cardiologist. The patient will also be educated today that he can go to the ER and be seen. Part of the discussion with this patient will be a treatment plan. Patient is already showing symptoms and experiencing symptoms that are affecting his life. So the important thing with this patient is that we need to evaluate and discuss the procedural options. This patient has procedural options that include an aortic valve repair, which is to repair an aortic valve. The surgeons actually separate the valve flaps or the cuffs that have fused together. And another one that is really popular is structural heart, and that is the aortic valve replacement. It's also called a TAVR. This is done in the cath lab by a cardiologist with surgical backup. It is a procedure that is invasive, but the patient will stay in the hospital only for 1 or 2 days, and then the patient will go home. The results of the TAVR replacement, the patients have been noted to, their quality of life has improved more than 70%, and they live a long time with it.